Hello dear all, Namaste. In this video, I shall be discussing about the clinical features of allergic rhinitis. As per the old classification, the allergic rhinitis can be divided as seasonal, perennial and occupational type. As per new area classification, it can be classified as mild symptoms or moderate to severe symptoms or intermittent symptoms and the persistent symptoms. So the symptoms are sneezing, which is most common symptom, that is typically paroxysmal, happens time and again, frequent intervals throughout the day, and more in the morning times. Because the allergens fall on the ground during the morning times because it's more cold. In the daytime, the allergens lie high up in the atmosphere. The nasal discharge is watery, mucoid, and sometimes yellowish. If there is no infection as well, the even in the absence of infection, the discharge may be yellowish because of increased eosinophilic load. So it may be a common question to be asked in a viva. The patient also has nasal obstruction or blockage, and the patient will have sneezing of nose. The patient will also have itching of the nose, eyes, and palate. The patient may have tearing or redness of the eyes and periorbital edema. The patient may complain of burning or a sensation of the throat, and the patient occasionally may have wheezing or chest tightness. This is to bring to your notice that around 40% of patients having allergic rhinitis may have allergic asthma in their lifetime. What are the symptoms of perennial allergic rhinitis? They are long-standing nasal congestion and PND, that is postnasal drip. The patient persistently clears his throat like this. The nasal discharge may be viscous or purulent, sometimes due to infection. Sneezing and conjunctivitis are less frequent, and patient may have secondary symptoms like loss of smell and taste, sinusitis, and station tube dysfunction. There are different named signs of allergic rhinitis, which may be asked in the exam, especially the facial signs in allergic rhinitis. The signs may be seen on the nose as transverse crease at the dorsum of nose. You can see a blackish line here at the dorsum of nose. This is a black line, which is called as Darier's line, may be asked in the exam. And patient also may have persistent rubbing of the nose from below upwards, that is also called as allergic salute or salute sign. The patient may have watery nasal discharge coming out from the nose. On examination, the nasal mucosa will be seen as pale or bluish, in contrast to intrinsic rhinitis, when the patient will have boggy turbinates or pinkish turbinates. The patient may have boggy and swollen or hypertrophied turbinates in allergic rhinitis also. The patient may or may not have nasal polyps, and there may or may not be septal deviation. You can see here, this is Darier's line, this is allergic salute, and this is swollen nasal mucosa. The signs in the eyes are periorbital edema, conjunctival congestion, and watering from the eyes. The patient will have marked erythema of the palpebral conjunctiva and papillary hypertrophy of the tarsal conjunctiva, that is also called as cobblestone appearance in the eyes. The patient will have dark circles under the eyes, also called as allergic sinus, which are commonly asked in the exam. This is due to repetitive vigorous rubbing in the periorbital region. The skin over here is very thin, therefore there will be dark circles. The second cause for allergic sinus will be impaired venous return from the skin and subcutaneous tissues because of swelling. There may be presence of extra skin folds or creases under the lower eyelids, also called as Denny-Morgan crease. These are the allergic sinus. You can see here. This is the picture of allergic sinus, and this is Denny-Morgan crease. Okay, this is allergic sinus, and in the ear the TM may be retracted or patient may have otitis media diffusion. In the pharynx, the patient may have granular pharyngitis or cobblestone appearance. Granular pharyngitis may be due to postnasal drip as well. The patient occasionally may have laryngeal edema when the patient having acute exacerbation of allergic rhinitis, and patient may have bronchospasm as well. As already told, around 40% of patients with allergic rhinitis may have allergic asthma in their lifetime. If you like this video, please subscribe my channel Dr. Krishna Koirala for more videos like this. Thank you very much.